So being a homemaker, mother of 3 kids and having in-laws, moreover a profession like teachers when they are not allowed to sit at all. So I become the most appropriate patient for varicose vein. So this was not my first surgery, first of all, but what happened over there was quite different from what happened over here. That time I did not know anything. It's quite grown-up veins, matured veins, bad veins. So it has to be treated because it was almost more than 20 years old.
Yeah.
Few doctors also told me that it is not possible. But the first thing about when we choose anything, we tend to choose few things. First of all, I would ask Dr. Joshi, what makes you angry?
I wouldn't really let that go in my head because some things you can't control, and some patients really need a lot of explanations, but still, that's part of life. You have to do what you have to do. Hello, everyone. Uh, Glad to see you back here, and it's a great pleasure for me to have one of our patients, Mrs. Banojyotsna Ganguli ji. She's had the treatment with us almost a year back, and I'm so excited to know her journey through it. And welcome, Banojyotsna ji.
Thank you.
So, can you tell us a little bit about yourself? What do you do, and what was your journey through the varicose veins symptoms and all that?
Definitely, doctor. And first of all, a big thanks that I have got a huge difference what I was and what I am now. But to begin with, I would like to say that talking about varicose vein, I would say that it is like, first of all, I never had any faith that it will go away.
Oh.
And it was like, I thought I'll be living with it. But few doctors also told me that it is not possible. But to tell about myself, I would say that I'm the potential customer of varicose veins, because it is said after that we knew, doctors also told me that if you have long standing period and all. So being a homemaker, mother of 3 kids and having in-laws, moreover a profession like teachers when they are not allowed to sit at all. So I become the most appropriate patient for varicose vein. But yes, I was also told that heredity is also one factor. So from very childhood, I saw my mother also that she had this varicose vein and all. But after my first pregnancy, a little later to my pregnancy, I saw suddenly I have developed those.
Yeah.
Wow, I'm becoming mom now. So then doctors told me that you wear kneecap. That did not work. Later on, now I have 2 more kids, they are twins. So now I was suggested to wear socks, like stockings and all. So yeah, that was a great relief, but painful thing. Like you have to wear it, you can't wear something which is tight and all. So I came across something that it may cure, and the whole research was done by my husband. And moreover, to be very personal, I was shocked to know that a beautician who came to my house, she said that, why don't you get it treated? I said, what nonsense, doctor, tell me that it won't be treated. Then she said, why don't you see there's a huge banner at Khar and there's a big doctor and I know he treats.
Yeah.
I said, she knows and we don't know. So then my husband also researched, and it was all about like coming to Dr. Saurabh Joshi. Now, first thing about when we choose anything, we tend to choose few things. First of all, I would ask Dr. Joshi, what makes you angry?
What makes me angry? Well, I mean, medically, there won't be anything that a patient does that will make me angry, because, like, we've been there and seen it all. But in general, I mean, personally, there are a lot of stuff in the house that makes me angry really quickly. But with a patient, I don't think anything would really make me angry, professionally, or even if the patient asks 1,000 questions, I would still patiently give an answer, because I mean, you are helping somebody who they really don't know about it. So there's no point in getting angry at anything as such. But otherwise, if you come at home and if you ask my wife, that she'll give you a long list of what really makes me angry. But from the patient's point of view, there's nothing that can make me angry. Even if I have to go to do a surgery at another hospital and it's 8 o'clock in the morning planned and we are all there, and I get the OT at 12 in the afternoon, I'd still take it. I wouldn't really let that go in my head, because there's some things you can't control, and some patients really need a lot of explanations, but still, that's part of life. You have to do what you have to do.
So his last point I'm taking, I asked him lots of questions and he never got angry. So first choosing him as my doctor was this criteria. I have never seen him being angry. So as you said, he's never angry with the patients. So I asked what not question. What if I jump from the OT? Because it is said that you'll not be given anesthesia. And I asked him all stupid and all nonsense questions also, but he took the patience to answer that.
I mean, the no questions are nonsense. They are relevant to you. So, I mean, it's a valid question, right? If I tell you, if you poke me a needle, then I might get startled and jump. So, but it's, it's a valid question from your point of view. But still, I mean, if you need to know the answer, then you need to know the answer, right? You don't, it was a valid question only. It wasn't something like that.
So, my coming to this varicose vein treatment was first thing. That doctor was very patient and he made me everything clear. And then I thought, let's go with it. And then we had this, he did some tests, that is scan, you say, right?
Yes.
So they check all the veins and all. And he said I had quite grown up veins, matured veins, bad veins. So it had to be treated because it was almost more than 20 years old.
Yeah.
And then I was everyone decided a date and then we went and cleaned.
So how did you feel when you were actually doing the VenaSeal procedure? So I like to know a patient's point of view, when you're lying down and somebody's doing something, what is going on in your mind? Were you really scared up to the point that we started, or how were you feeling?
So this was not my first surgery, first of all, but what happened over there was quite different from what happened over here. That time I did not know anything. Over here, your eyes are opened and then you get into the room OT and doctor tells you he will play a music which I will listen. So he did that. He played a music.
Yeah.
But after that, I think so something was given. So
I think some mild sedation, relaxing medicine is given that, that takes your mind off, but you're not totally unconscious. You're just, mildly sleepy perhaps.
Yeah. That's what happened to me. Like I got a chance to sleep also.
Yeah.
So listening to the music, I had you can say nap, not a sleep. And then suddenly I was awakened and then I think so the other part of my leg was done. Then actually I did not feel any pain or anything like it was happening over there. Means till I was said that it's all done, I actually did not feel anything.
Yeah.
And that's the glory, I can say. I was awake, but I did not feel about that. After that, the plasters were also not very ugly. This was the first time I saw the plasters done with some. So my legs also did not look any ugly. And I walked down from the bed and went to the place where I had to take rest and all in the hospital. And then things went on. And the first thing was doctor followed up everything like stage by stage. And I was recovering. That's what I felt. But I did not take any step which was not asked by doctor. Like I asked every time, shall I do this and shall I do that? And in the 4th month, first I came after 2 months. And then when I asked doctor, like we wanted to go to Shimla. It was a trip, hilly area. So we asked him, can we do that? He said, yes, of course. And that time I think so I said, you may remove that stockings part also. Though I wore it for precaution, but I removed it. And I sat on the back of the horse and my husband said that we should convey this to doctor that you're doing these stunts also.
Yeah, nice.
And then everything went smoothly and now almost it's going to be a year or so. And now I'm without stockings. I walk faster. I feel free. And to the women part of thing also, I don't like earlier I used to not wear anything which would show my legs. Aesthetically also it looks good, but physically also. And one thing more I wanted to alert over here is, I was never so conscious about this thing unless one of my aunts, she was to a late stage and those veins got burst.
Yeah. Oh.
And I was told it's a very wrong time, like we shouldn't make it to that position.
Yeah.
I came to doctor also, he also said that this happen, that if we don't get treated.
Yeah, it does, and we do get a lot of patients, at least with 2 or 3 patients a week come after it. It's an acute emergency sort of a thing, where they have come to know that they have the veins only after the blood comes out. So, and that is like, that's something which should be avoided. We shouldn't reach up to there. And so other than that, if you see pictures of your leg before and you see a leg right now, so what comes to your mind? You're like, do you I remember I told you that you will not, if you see your photos later, and you will not believe that this is this is not your leg anymore.
But no, I remember those legs because they were so used to, and it was so old enough, and mine was like it was bulging out. It's not that it was very small or something. So it was very prominent, but it is quite different. Even my daughter said, "Mom, your legs have changed a lot, and it looks thinner. It looks naturally the veins are not out, so it looks good.
Great.
And no marks of surgery. Great. Only one small dot is there.
Where we inserted the VenaSeal from. So what would what would your message be for a patient who's exploring about these various options, and which doctor to go and what to do and all that? So personally, what my opinion is, when a patient tells me what kind of procedure should I do the laser procedure or the VenaSeal procedure? But out of all that, having done laser procedures back in the past, I would say that what is a real standout is not even the procedure, it's the follow-ups. Okay. That the fact that we did your scan 7 days later, and then maybe 2 months later and a few months later, that's the most what do you say, value addition. Procedure wise, even if I had to do laser, we could have made you unconscious and done it. But what you do later, that matters, and so what would your advice be to a prospective patient?
So when we see to VenaSeal, and it is so convenient, because to be honest, we went to other doctors also, and few people say that like whatever you go to, that old conventional method, I think so, they seal the veins and
the stripping, or they remove the veins.
Something like that. I was told like that. So hearing to that only, I felt it's quite painful. And that doctors also, they admitted that it's quite painful and you won't recover soon after that. But VenaSeal, you walk, you don't be dependent on anyone. And my gynecologist also, she said that she had the same disease. And when I was treated, I thought that more than my life, it is her life. So I thought like conveying this to her also, that please, ma'am, go and get it treated, rather from the Saurabh Joshi only. But of course, it's someone's choice. But I would say whoever is like in this suffering stage, please don't sit back. Please go ahead. And I think so this is the good option rather to getting it burst. Because I have seen that and I am really scared about that stage. And VenaSeal has been proven, to me at least, no pain, no dependency on anyone, and recovery also was very good.
Great.
So thanks to Dr.
Thank you, Banojyotsna ji. It was a pleasure having you and giving us great insights on your journey for over a year now. And I hope you continue to do well. And thanks for taking out the time and coming and sharing with us. It was a pleasure. Thank you. Thank you.